everyone. This is Chadi Alraies from NCVH 2025. I'm really privileged to be again with Dr. Chris Bromley to talk about the role of AI or the use of AI in the clinic for management of wound care. Chris, thanks again for being with us.
It's so exciting to see you. I'm so grateful to be back here in New Orleans, and I was hoping I'd run into you.
That's great. I mean, we would like to hear some updates since last year we did an interview with you about app-based wound clinic and your referral generated. So there's some development. So give us
Sure. So last year we spoke about CarePix, which we had spent a number of years developing a digital wound tool for providers to take a picture with their cell phone. It would digitally measure the wound. And we had the great opportunity to be acquired by a company called Tissue Health Plus. They are taking our platform and have developed a whole new platform that uses the AI to drive best practice. So it uses evidence-based medicine. Every single wound has a digital image, and then the infrastructure of that platform tells the provider, based on the wound and based on the things that it's seeing and you answered, what would be best practice. So it raises everybody's floor, and it makes it easier as a company to make sure that all of our providers are really doing what they should do. And then the real key to that is the data, because we're going to be able to come back and look at the data retrospectively. Well, was this particular treatment, did it match what evidence-based medicine said? And then what are our outcomes? So super exciting.
It is, I mean, and the role of AI is very important. This is where it's going to come filling the gap of knowledge and giving option for the providers who are seeing this for the first time or even for experience of prayer.
Yeah, and sometimes when I'm talking about this to providers, they're a little nervous. Like, I don't want to be replaced by AI, or how do we know the AI is safe? I think in this particular situation, we know that we're using the Tissue Health Plus platform to drive best practice, because it's going back and pulling all of the evidence-based medicine. As a provider, you can opt out of that. So it could say, hey, Chris, based on what this wound image is and the size and the questions, this is what would be. Let's say it's a foam, but you could override that, and you could say, you know, based on the patient's unique medical history or based on something I'm seeing, I'm going to do something else. So you always have the option as a provider to take the recommendation or adjust it.
And this is only for wound care and wound clinic as well, right?
So this is where we started. So Tissue Health Plus is a company that has a lot of other aspirations. So we're looking at doing a number of other specialties. So a little hint, one of my companies that I run now is called Restore First Health. We started as a mobile wound care company. We are now a mobile healthcare company. So we're doing acute care, bridge visits. So we're going to be developing AI algorithms for shortness of breath, urinary tract infection, any of the things that we're seeing in that mobile space. We have AI to support us driving evidence-based medicine to make sure that the treatment that's being done is always best practice.
That's great. I mean, this is really exciting. And last thing I would like you to input on is the scribe.
Yes. So when we met last year, I told you that my world changed when I started using Athelis as the AI-based scribe in my clinic. And I'm still practicing a little bit longer. And in my clinic, I use Athelis as the tool to help me when I'm seeing patients. So instead of spending time typing into a computer and worrying about the medical record, I can actually sit with the patient and let the AI listen to our entire conversation. It'll filter out the nonsense about a visit to Disney. And then when I'm leaving the room, that text has been converted into a SOAP note that's in my chart with the recommended diagnosis and procedure based on things that I said. So I can basically spend all of my time focusing on the patient and none of my time. And the biggest thing that I didn't realize was I had spent probably the last 15 years having PTSD because of the electronic health pressure record documentation that we live in, right? So I don't have that PTSD anymore. I actually look forward to going to the clinic and I look forward to seeing patients because I don't have the 800-pound EHR gorilla sitting on my shoulder putting so much pressure on me.
Ask you the manager close your note at this time, bill stuff.
So I'm having so much more fun. And if it wasn't for that, I probably would have left practice already and just done the corporate stuff.
Thank you again, Chris, for enlightening us and about this update, and congratulations for the development development with the company and acquisition. Watch the videos and others on the YouTube channel of NCVH. This is Chadi Alraies coming to you from NCVH Conversations 2025. Chris, thanks again.
Thank you very much. Appreciate it.